Ever wondered what those ECG lines actually mean and what are these leads that doctors keep talking about? Hi everyone, I am Dr. Komal Gupta. I am a foreign medical graduate and today we will be breaking down ECG from inside out. We will cover how the heart's electrical system works, the real physics behind the leads, and also how those lines help us decode heart like a pro. So let's get into it. We will start at the source, the heart. Now, your heart isn't just a pump, it's also an electrical generator. Every heartbeat starts with a tiny spark at the SA node in the right atrium. This spark travels like a wave through the atria, which causes the atrial contraction. Then it reaches the AV node, pauses briefly, and then rushes through the bundle of His and the Purkinje fibers, which then causes the ventricles to contract. Now this flow of depolarization is a flow of positively charged ions. They move across the heart muscle and creates tiny voltage changes on the surface of your skin. That's what the ECG machines pick up. Now, let's talk about the science behind how does this ECG even work and how do ECG machines detect it. All of this is based on simple physics and vector principle. Imagine the heart's electrical activity as a vector. It has both direction and strength. When this electrical wave moves towards a positive electrode, the ECG shows a upward or a positive deflection. And when it moves away, the ECG shows a downward or a negative deflection. Each ECG leads act like a camera placed at a particular angle around the heart. It doesn't look inside the heart. It simply watches how these electrical waves move. Leads measure voltage differences between 2 points. So the ECG doesn't show us just one angle, it gives you 12 different views thanks to the 12 different leads. So, how do these leads work? First we will talk about the limb leads. They work on the frontal plane. Now these leads form something called the Inthoven's triangle. The lead 1 goes from right arm to left arm. Lead 2 goes from the right arm to left leg. And the lead 3 goes from left arm to left leg. These leads are bipolar. That means they measure electrical differences between two limbs. Then we have augmented unipolar leads, which are 3. The first one, AVR, it looks from the right shoulder, R, right shoulder. AVL is from the left shoulder and AVF is from the foot. These augmented limb leads, they compare one limb's signal to an average of the other limbs. These together give you a frontal plane view of the heart. Now comes the chest leads. They show us the horizontal plane. They are 6, V1 to V6. V1 and V2 look through the septum or through the right side. V3 and V4 show us the anterior wall and V5 and V6 show us the lateral wall. These are the unipolar leads and they give us a horizontal plane view, almost like the CT scan slices. Okay, now these might be going over your head, so I'll give you a simple example. Okay, we will talk about the lead 2. Lead 2 runs from the right arm to the left leg. Point to be noted is that its positive electrode is on the left leg and the negative one is on the right arm. When we look at the heart's electrical activity, when the atria depolarizes, these waves they move downward and leftward. That means straight towards the positive electrode. Now that gives you the P wave, which is a positive upward wave. After atrial depolarization, the ventricles depolarize. In that case too, the vector moves downward and leftward. That's why the QRS complex, it also forms a positive upward spike on the ECG. Finally, the ventricular repolarization. Now that also moves in the direction of the left leg, that is towards the positive electrode. So again in lead 2, the T wave also is in the upward direction or a positive spike. Now this is exactly why lead 2 is used for rhythm monitoring because it gives a real nice and clear view of heart's electrical activity flowing in its natural direction from right towards left. So as a summary to this video, point number 1, the heart generates tiny electrical signals. Point number 2, ECG leads are just smartly placed voltage detectors. They use basic physics and vector math to give you 12 different views of your heart's activity. And by reading them correctly, we can diagnose everything from a heart attack to electrolyte imbalances. So, if this helped simplify ECG leads for you, don't forget to like, comment and subscribe to my channel. Also, share this with your friends who still get confused with ECG leads. I will also be making a video in which I explain easy and simple ways to identify the different ECG abnormalities. So stay tuned and I'll see you in my next one. Bye.